1. Parkinson's disease is characterized by increased dopamine production in the brain. True or false? Answer: false. Rationale: Parkinson's disease is caused by decreased dopamine levels due to degeneration of dopamine-producing neurons in the substantia nigra, leading to symptoms like tremors and rigidity. 2. The Glasgow Coma Scale assesses a patient's level of consciousness using eye, verbal, and motor responses. True or false? Answer: true. Rationale: the Glasgow Coma Scale, GCS, evaluates consciousness through eye opening 1 to 4, verbal response 1 to 5, and motor response 1 to 6, with a total score of 3 to 15, guiding neurological assessment. 3. A lumbar puncture is contraindicated in patients with increased intracranial pressure. True or false? Answer: true. Rationale: a lumbar puncture in patients with increased intracranial pressure can cause brain herniation due to rapid cerebrospinal fluid (CSF) removal, requiring imaging to rule out this risk first. 4. Stroke is the leading cause of epilepsy in adults. True or false? Answer: false. Rationale: while stroke can cause epilepsy, the leading cause in adults is often idiopathic or related to other factors like trauma or tumors, per epilepsy research. 5. Multiple sclerosis is characterized by demyelination of neurons in the central nervous system. True or false? Answer: true. Rationale: multiple sclerosis, MS, involves immune-mediated demyelination of neurons in the brain and spinal cord, leading to impaired nerve conduction and symptoms like weakness or vision loss. 6. Seizures always involve loss of consciousness. True or false? Answer: false. Rationale: seizures can be focal, partial, without loss of consciousness, or generalized with loss of consciousness, depending on the brain area affected, per epilepsy classification. 7. Alzheimer's disease is primarily diagnosed through a blood test. True or false? Answer: false. Rationale: Alzheimer's disease is diagnosed through clinical evaluation, cognitive testing, and imaging, e.g., MRI, as no specific blood test confirms it, per diagnostic criteria. 8. Administering lorazepam is a priority for a patient with status epilepticus. True or false? Answer: true. Rationale: status epilepticus, a prolonged seizure, requires immediate administration of benzodiazepines like lorazepam to stop seizure activity and prevent brain damage, per emergency protocols. 9. Tremors in Parkinson's disease are most prominent at rest. True or false? Answer: true. Rationale: resting tremors, often described as pill rolling, are a hallmark of Parkinson's disease, worsening at rest and improving with purposeful movement, per clinical features. 10. A transient ischemic attack, TIA, causes permanent neurological damage. True or false? Answer: false. Rationale: a TIA is a temporary blockage of blood flow to the brain, causing transient symptoms without permanent damage, though it increases stroke risk, per American Stroke Association guidelines. 11. The Babinski reflex is normal in adults with neurological disorders. True or false? Answer: false. Rationale: a positive Babinski reflex, upgoing toes, in adults indicates upper motor neuron dysfunction, abnormal in neurological disorders like stroke or MS, per neurological assessment standards. 12. Myasthenia gravis is caused by an autoimmune attack on acetylcholine receptors. True or false? Answer: true. Rationale: myasthenia gravis involves autoantibodies attacking acetylcholine receptors at the neuromuscular junction, impairing muscle contraction and causing weakness, per pathophysiology. 13. An EEG is used to diagnose Alzheimer's disease. True or false? Answer: false. Rationale: an EEG may rule out other causes, e.g., seizures, but is not diagnostic for Alzheimer's, which relies on cognitive testing and imaging, per diagnostic guidelines. 14. Hemorrhagic stroke is treated with thrombolytic therapy. True or false? Answer: false. Rationale: thrombolytic therapy, e.g., TPA, is used for ischemic stroke to dissolve clots, but it's contraindicated in hemorrhagic stroke due to bleeding risk, per stroke management protocols. 15. Patients with epilepsy should avoid driving until seizure-free for a specific period. True or false? Answer: true. Rationale: Patients with epilepsy must be seizure-free for 6 to 12 months, per state laws, before driving to ensure safety, requiring patient education, per epilepsy management guidelines. 16. Increased intracranial pressure can cause Cushing's triad. True or false? Answer: true. Rationale: Cushing's triad, bradycardia, hypertension, irregular respirations, is a late sign of increased intracranial pressure, indicating brain herniation risk, per neurological emergency protocols. 17. Guillain-Barré syndrome is characterized by ascending muscle weakness. True or false? Answer: true. Rationale: Guillain-Barré syndrome involves autoimmune demyelination of peripheral nerves, causing ascending weakness starting in the legs, potentially progressing to respiratory failure. 18. All patients with migraines require hospitalization. True or false? Answer: false. Rationale: most migraines are managed outpatient with medications, e.g., triptans and lifestyle changes. Hospitalization is rare unless complications like status migrainosus occur. 19. The nurse should place a patient with a suspected stroke in a supine position. True or false? Answer: false. Rationale: patients with suspected stroke should have the head of the bed elevated to 30 degrees to reduce intracranial pressure and promote cerebral perfusion, per stroke care guidelines. 20. Levodopa is the first-line treatment for multiple sclerosis. True or false? Answer: false. Rationale: levodopa is used for Parkinson's disease to replace dopamine. MS is treated with disease-modifying therapies, e.g., interferon, per treatment guidelines. 21. A patient with a spinal cord injury is at risk for autonomic dysreflexia. True or false? Answer: true. Rationale: autonomic dysreflexia, a life-threatening condition, can occur in spinal cord injuries above T6, triggered by stimuli like bladder distension, causing severe hypertension. 22. The mini-mental state examination is used to assess seizure activity. True or false? Answer: false. Rationale: the mini-mental state examination assesses cognitive function, not seizure activity, which is evaluated with EEG or clinical observation, per diagnostic tools. 23. Dysphagia is a common complication of stroke. True or false? Answer: true. Rationale: stroke can impair cranial nerves or motor control, causing dysphagia, increasing aspiration risk, and requiring swallowing assessments, per stroke care protocols. 24. Anticonvulsants like phenytoin can cause gingival hyperplasia. True or false? Answer: true. Rationale: phenytoin, an anticonvulsant, can cause gingival hyperplasia as a side effect, requiring oral hygiene education and dental monitoring, per pharmacology principles. 25. Bell's palsy is a permanent condition affecting facial muscles. True or false? Answer: false. Rationale: Bell's palsy, a temporary paralysis of cranial nerve 7, typically resolves within weeks to months with supportive care, though rare cases may persist, per clinical features. 26. The nurse should restrain a patient during a seizure to prevent injury. True or false? Answer: false. Rationale: restraining a patient during a seizure can cause injury. Instead, the nurse should protect the patient by clearing hazards and supporting the head, per seizure management protocols. 27. Amyotrophic lateral sclerosis, ALS, affects both upper and lower motor neurons. True or false? Answer: true. Rationale: ALS is a progressive neurodegenerative disease affecting both upper motor neurons, causing spasticity, and lower motor neurons, causing weakness, per pathophysiology. 28. A CT scan is the gold standard for diagnosing epilepsy. True or false? Answer: false. Rationale: EEG is the primary diagnostic tool for epilepsy, detecting abnormal electrical activity. CT scans may identify structural causes, but are not the gold standard, per diagnostic criteria. 29. Hypertension is a major risk factor for ischemic stroke. True or false? Answer: true. Rationale: hypertension damages blood vessels, increasing the risk of clot formation and ischemic stroke, making blood pressure control critical, per American Stroke Association guidelines. 30. Patients with Parkinson's disease are at risk for falls due to bradykinesia. True or false? Answer: true. Rationale: bradykinesia, Slow movement in Parkinson's disease impairs balance and coordination, increasing fall risk, requiring safety interventions, per nursing care plans. 31. A patient with meningitis should be placed in a well-lit room. True or false? Answer: false. Rationale: meningitis causes photophobia. Patients should be in a dimly lit, quiet room to reduce discomfort and prevent seizures, per neurological nursing care standards. 32. Donepezil is used to improve cognitive function in Alzheimer's disease. True or false? Answer: true. Rationale: donepezil, a cholinesterase inhibitor, enhances acetylcholine levels, improving cognitive function in Alzheimer's disease, though it does not halt progression, per pharmacology. 33. Trigeminal neuralgia is characterized by chronic muscle weakness. True or false? Answer: false. Rationale: trigeminal neuralgia causes severe, episodic facial pain due to cranial nerve V irritation, not muscle weakness, per clinical presentation. 34. The nurse should monitor for respiratory depression in patients receiving baclofen. True or false? Answer: true. Rationale: baclofen, a muscle relaxant used in conditions like MS, can cause central nervous system depression, including respiratory depression, requiring close monitoring, per pharmacology. 35. Huntington's disease is caused by a viral infection. True or false? Answer: false. Rationale: Huntington's disease is a genetic disorder caused by a mutation in the Huntington gene, leading to progressive neurodegeneration, not a viral infection, per pathophysiology. 36. A patient with a traumatic brain injury is at risk for cerebral edema. True or false? Answer: true. Rationale: traumatic brain injury can disrupt the blood-brain barrier, causing cerebral edema, which increases intracranial pressure and requires urgent intervention, per neurotrauma care. 37. Non-pharmacologic interventions for migraines include a high-sugar diet. True or false? Answer: false. Rationale: non-pharmacologic migraine management includes avoiding triggers, maintaining hydration, and a balanced diet. High sugar may worsen migraines, per patient education guidelines. 38. The nurse should elevate the head of the bed for a patient with increased intracranial pressure. True or false? Answer: true. Rationale: elevating the head of the bed to 30 degrees promotes venous drainage, reducing intracranial pressure in patients with brain injury or stroke, per neurological care protocols. 39. Peripheral neuropathy is a common complication of diabetes mellitus. True or false? Answer: true. Rationale: chronic hyperglycemia in diabetes damages peripheral nerves, causing neuropathy with symptoms like numbness and tingling, requiring foot care education, per diabetic complications. 40. All patients with multiple sclerosis experience complete remission between relapses. True or false? Answer: false. Rationale: while some MS patients experience remission between relapses, others have progressive symptoms without full recovery, depending on the disease course, per clinical patterns.